lectures to come. ये आप चैप्टर आप पहले भी एक बार आप देख चुके हो. So we'll quickly go through some of the points of the chapters. We'll solve some questions and we'll cover some important topics from the chapter. तो जैसे कि हमारा आज का टॉपिक हमारा जो रहेगा, that's going to be all about the contraceptives. So what are the different ways of contraceptives, natural and other barriers of contraceptives we'll talk about. एक बार वो हो गया, then we can have a look at the MTPs. MTP क्या होता है हम वहाँ पे देख लेंगे, and this is something we'll try to cover आज के क्लास में, and some question solving. ठीक है. So now let me start the screen. Let me know अगर कोई screen दिखे ना तो just let me know that. All right. So let's start with the methods to control population explosion. So how we can actually control population going like expanding, how we can control that. So यहाँ पे हम लोग discuss करेंगे यहाँ पे like how like you can actually promote having the smaller families. So government ने काफी तरीके से काफी जगहों पे ये चीज promote की थी that people should have a very small family, like not more than 4 people should be there in the family. Increasing the legal age of marriage. So legal age of marriage was made to 18 for girls and 21 for the boys. So that is something which was done. That is also one of the way through which you can avoid having way too many number of babies in the early days of the girl, right? So along with that, other methods which we'll be discussing in detail are going to be like something like your physical barriers like condoms, diaphragm and copper T are some of the barriers we'll be discussing right now. And other pills. So these are the pills we'll be discussing, like how they are useful as contraceptive methods. Okay. So promote use of contraceptive methods. So now let's have a look over here. Ideally, contraceptive should be, how should it behave? So these are some of the points which should be clear to all of you. ये सारे points आपको यहाँ पे याद रखते हैं because again ये points कई आपके statement वाले question में आ जाते हैं. तो एक ideal contraceptive कैसा होना चाहिए? So like ideal contraceptive should be easily available, should be easy to use, should be effective, and should not have side effect. ये कुछ आपके यहाँ पे points हैं, ये कुछ आपके पे traits हैं which you should see in the ideal contraceptive के अंदर आपको देखने के लिए मिल सकते हैं. Natural method, barrier method, IUDs, surgical methods, and you have a oral contraceptive. So these are the different contraceptives you have in front of you, and इनको ही हम यहाँ पे एक बार revise करेंगे, इनको ही हम यहाँ पे एक बार समझ लेंगे. So let's start with that. All right. So जब natural method की यहाँ पे बात कर रहे हैं, so basically what happens, you know that during fertilization the sperm is over there. That's here going to be the normal fertilization happening over there. Okay. It works on a principle of avoiding chances of meeting sperm and the egg, right? That is something. So natural method mein, you are actually going to ensure that there is no fusion of sperm and egg happening over there. So periodic absentia, coitus interruptus, and lactational amenorrhea are the example of my natural methods. Now, periodic absentia is the way in which you will find the copulation is being avoided from day 10 to day 17. In this method, the couple are going to avoid copulation or sexual intercourse from day 10 to day 17. Now the reason in this period because there's a very likely chance of the sperm getting fused with the egg, because this is a time period when you find the ovulation will happen, right, in that particular time frame. So that is why you actually try to avoid having the sexual intercourse in this particular time frame, and that's called periodic absentia. Then you have coitus interruptus. Coitus interruptus says that withdrawal of the penis right before the ejaculation. So withdrawal of the penis right before the ejaculation is a way through which one can avoid the sperm reaching to the female reproductive tract. So that's the second way. Third way is going to be lactational amenorrhea. इसमें आपको क्या मिलेगा? That during the lactating period, जो 6 महीने का lactating period आपका वहां पे रहता है, in that time frame you don't find any kind of menstrual cycle running. So menstruation ये time पे halt पे रहेगा, and that also means any kind of sexual intercourse during this time period will not lead to pregnancy. So these are the three ways through which you will find these are three natural ways through which you will get to see that one can actually avoid getting conceived, and that is all by natural methods. Okay, so you have this periodic absentia, coitus interruptus, and your lactational amenorrhea. So these are the three terms you have to know. Let's have a look. Avoiding coitus from a day 10 to day 17th, right? Because that is a fertile period. That is when you can potentially find the ova getting released over there, and there's a likely chance of getting conceived. So you avoid that. Coitus interruptus is going to be a male withdrawing the penis from the vagina right before the ejaculation. So that is something I've discussed. And then absence of menstruation during the lactating period, which will last for 6 months. So yeah, the time frame is going to be 6 months. So during that 6 months, there is no likely chance of getting conceived because there won't be no menstruation. कई बार होता है कि आपको क्वेश्चन में आता है और वहां पे लिखा जाता है that in the lactation amenorrhea, the chances of getting conceived are nil for 2 years. Now that's a wrong statement. 2 साल के लिए नहीं होता, वो 6 महीने के लिए होता है. So these are the things you have to know. Okay. So chance of pregnancy is almost nil, and time you should always remember is going to be for your 6 months. Now, as no medicine or device are used in this method, side effects are almost nil. So all these methods, these are my natural methods, and you don't find any kind of side effect happening because of these methods. But chances of failure are also high. There are chances of failure are also going to be high in this. So ये भी याद रखना. It's going to be high, right? Okay. So natural methods are based on the principle of. So these are the options you have. So natural methods are based on the principle of what? Yes, avoiding the chances of sperm and egg meeting. You avoid the chances of sperm and egg meeting over here. Now let's have a look at the barrier method. So barrier method आपके यहाँ पे क्या होते हैं? इनको हम यहाँ पे देखते हैं. So sperm and ova can be avoided to meet by using some barriers. These are going to be my physical barriers. Okay. So barrier method are available for both and the male and female. Males you will have male and female condoms both are available, which are going to be a barrier method. Now there's one thing you have to know. They are made up of like latex sheet, and they are known to cover the vagina or the male penis. Now there's one thing you have to understand, that these method using condoms are also going to protect the person from the STDs. Using such kind of barrier method are also going to protect the person from the STDs. So this also protects from STD. So sexually transmitted disease can be prevented by using such kind of barrier method. Along with that, one of the main role of this barrier is going to be to avoid any kind of possibility of getting conceived. So these are some of the common barrier methods which are being used in the males as well as in the females. Then, what are the advantages over here? Advantages are going to be they are disposable. So condoms are generally going to be disposable. They prevent contact of the genital fluid. So there is no chance of any kind of genital fluid getting in contact, and they help preventing the STDs. So these are some of the advantages of using this condoms as a barrier method, right? Along with that, you can also have something like a diaphragm. Now diaphragms, cervical caps, and valves are being used by the females, and they are being inserted inside the vagina and the cervix. So these are some of the structures like diaphragm, cervical caps, and valves which are being inserted in the vagina and the cervix, and these are the barrier methods for the female, right? Now usually what we have seen that along with this barrier method, some creams and jellies are also being used. इनकी इफेक्टिवनेस बढ़ाने के लिए, so इन barrier method के साथ साथ कई बार यहाँ पे creams और jellies का भी इस्तेमाल किया जाता है. And those creams and jellies are known to kill the sperm, sperms. Okay. So diaphragm, cervical caps, and valves are also barrier made up of rubber that are inserted into the female reproductive tract to cover the cervix during the coitus. Now, there's one thing you have to understand: they're reusable. Unlike the male condoms and female condoms, they are not disposable. They can be reused. They prevent conception by blocking the entry of the sperm through cervix, and they are reusable. Spermicidal creams, something I've just told you, spermicidal creams and jellies and foams are usually used with these barriers to increase their contraceptive efficiency. So इनको अकेले यूज नहीं किया जाता, काफी बार इनके साथ साथ स्पर्मिसिडियल क्रीम्स, जेलीज और फोम्स का यहाँ पे इस्तेमाल किया जाता है, और इनकी वजह से इनकी एफिशिएंसी यहाँ पे बढ़ जाती है. बिकॉज ऑफ दैट द एफिशिएंसी ऑफ देम इज गोइंग टू इंक्रीज. So that is something you have to know. These are a few things you have to know in terms of these physical barriers. Then we have the intrauterine device. Now, if they ask you that in the country, which is the most widely accepted barrier, then your answer will be IUDs. Or rather, they will ask you which of them is going to be the most highly accepted contraceptive. The answer is going to be the IUDs. So they are most widely accepted in the country. That's one thing you have to know, right? Now, IUDs are inserted by doctors or nurse inside the uterus through the vagina. So intrauterine device are being inserted inside the uterus. Now, this one thing should be clear to all of you. जब कपल को काफी हद तक श्योरिटी होती है दैट दे आर नॉट प्लानिंग टू हैव अ बेबी फॉर नेक्स्ट 3 to 5 years, they can go for this. When they are very much sure that they don't want to have any kind of like family planning, उनको भी plan नहीं है for next 3 to 5 years के लिए, then they can actually go for this because it is something once you insert it, na, right? It will do its job until it's work here. You will not find the girl getting conceived. So IUDs are inserted by doctors or nurse inside the uterus through vagina. Okay. So some of the example of IUDs are going to be your non-medicated IUDs, copper-releasing IUDs, and hormone-releasing IUDs. These are the three different type of IUDs. इनके नाम आपको याद रखने हैं. You have a lippy loop. That's a non-medicated IUD आपको यहाँ पे मिल जाएगा. Copper-releasing IUD आपको यहाँ पे हो जाएगा आपका copper T, copper 7, and multi-load 375. नाम काफी अलग है लेकिन याद रखना. It is also my copper-releasing IUD. And then you have a progesterat and LNG20. These are my hormone-releasing IUDs. So all these IUDs will have their function. And now if I give you the example, copper releasing IUDs are the one which will ensure that they decrease the sperm motility. So जब मेल गैमेट्स आ रहे होते हैं वजाइनल ट्रैक के अंदर तो उनकी मोटिलिटी काफी सप्रेस हो जाती है. That is all because of the copper ions coming from the IUD. Similarly, hormone releasing IUD is the one which will play an important role in making the uterus unsuitable for implantation. So it will make the uterus unsuitable for implantation so that there is no likely chance of any type of implantation. See, copper releasing IUDs are going to release the copper ions, and these copper ions are going to suppress the sperm motility and fertilizing capacity of the sperm. So उसको वहाँ पे decrease कर देगा. So ultimately what will happen? The sperm has no energy to reach to the fallopian tube. So that's how you prevent the fertilization. Right? So that's what it will be happening over here. Then we have a hormone releasing IUD. What they do? They make the uterus unsuitable for implantation. Once the uterus is unsuitable for implantation, there is no chance the girl will get conceived. So ये चीजें आपको याद रखनी. These are the few things you have to know about this IUDs which have been used. As I've told you earlier as well, IUDs are generally used when they are very much sure that they don't want to have any kind of offspring for the next 3 to 5 years. That's when they go for that, right? It is something which cannot be like ऐसा नहीं कर सकते. It has like you cannot like use and reuse it multiple times like in a week. ऐसा नहीं हो सकता कि इसको आपने insert किया, remove किया, again insert किया. It's not like that. So it is something. It's a plan which you plan like you decide right in the beginning that you don't really want to have your family for a certain amount of time, and then you go for the IUDs. IUDs are ideal contraceptive for the females who wants to delay pregnancy or space the children. It is one of the most widely accepted method contraception of the country. And also remember, this is something which is not self-inserted. One has to reach out to a doctor or a nurse. They are going to insert those things. Okay. So that is something you have to know about the IUD. So ये example आपके सामने यहाँ पे as a सवाल आ सकते हैं. So examples आपको यहाँ पे रखने. These are the examples which become a question for you. So you should know them. Then, now tell me which of the following statement is going to be right. Choose the right one among the statement given below. So you have these 4 statements. You tell us which of them seems to be very much true. Anyone want to answer this? Okay. Now, IODs is something I've already told you that they are going to suppress the sperm motility. Now, when the sperm motility get decreased, those sperms get eaten up by there over there. So that is why you will find when you see this kind of question, you should know that in IODs, what they do now, once they decrease the sperm motility now, when they decrease the sperm motility, then what will happen? Those sperms in that area will get eaten up. So that is why you will find option B over here becomes the correct answer. So it would increase the phagocytosis reaction in the uterus. So going to increase the phagocytosis inside the uterus. Okay. So this is something you have to know. Then we have the oral contraceptives and surgical method. So oral contraceptive will have a progesterone estrogen combination. So here we will talk about the pills. यहाँ पे pills जाएगा. And using these pills, one can actually avoid getting conceived. इनको orally administrate किया जाता है. Side effect इनके यहाँ पे कम रहते हैं. And how the pills are going to work. So basically, once the person start taking these oral pills, because of that, the ovulation won't be happening. Now, because of that, ovulation won't be happening. Because of that, the person can actually avoid any chances of getting conceived. So this is one thing you have to know. So it is going to inhibit the ovulation and implantation. So ovulation यहाँ पे होगा नहीं और यहाँ पे implantation को भी यहाँ पे inhibit करेगा. Now, how this pills has to be taken? Pill have to be taken daily for a period of 21 days, starting preferably within the first 5 days of menstrual cycle, and then one has to take a break of 7 days. So one has to take the pill for 21 days, then you can take a break of 6 to 7 days, and then again they can start a new cycle. So that is how one has to take the pills, just to make sure that there is no chances of any kind of like getting conceived. So याद रखना, oral pills यहाँ पे main काम इनका यहाँ पे होता है, they avoid the ovulation. अगर ओवुलेशन ही नहीं हो रहा देन कोई चांस नहीं है फर्टिलाइजेशन होने का. And then they have a some amount of role to be played in terms of also avoiding the implantation. So after a gap of 7 days during menstruation, it has to be repeated. जो मैंने आपको बोला यहाँ पे is 21 days, then you take a gap, and during that gap you can again repeat the same cycle. You have the example of Saheli. Saheli is a non-hormonal pill, और ये आपकी बनाई गई थी CDRI लखनऊ में. सेंट्रल ड्रग रिसर्च इंस्टीट्यूट लखनऊ जो आपका है यहाँ पे इसको बनाया गया था. सहेली ये यहाँ पे होगी नॉन हार्मोनल पिल. So it will have less amount of side effect. This will have comparatively will have a less amount of side effect in them. Now these are the implants. These are some of the implants which you find getting inserted into the body. So basically implants implants will also going to release the hormones. They will also have single rotary plate to release the hormones. Now these implants are inserted inside the arm, generally subcutaneously. Subcutaneously मतलब skin के नीचे. So these implants are inserted. Let me write it down. They are inserted subcutaneously. सबक्यूटेनियस का मतलब आपको यहाँ पता है कि आर्म के अंदर, आर्म के नीचे इनको यहाँ पे हम इम्प्लांट को यहाँ पे लगा देंगे एंड इंसर्ट कराने के बाद इम्प्लांट को, देन दिस इम्प्लांट विल रिलीज द हार्मोन्स एंड नाउ दोज हार्मोन्स विल हैव अ सेम काइंड ऑफ रोल द वे योर पिल्स आर डूइंग. ओके, दे आर सिमिलर टू कॉन्ट्रासेप्टिव पिल्स, प्रोजेस्टेरॉन अलोन और इन अ कॉम्बिनेशन विद एस्ट्रोजन, या फिर अकेला प्रोजेस्टेरॉन होगा या फिर इट विल बी कॉम्बिनेशन विद एस्ट्रोजन. So that is how you are going to implant them. And once you implant them, it's a very simple, small surgery through which you can do that. And now you can find yourself safe to getting any kind of pregnancy. So ये चीज आपको यहाँ पे add करनी है. This is one thing you have to know. So here you have, okay, now this I pill and unwanted 72 are the example of my emergency contraceptive pill. So in case if a girl has, if someone has undergone a sexual intercourse and they want to, they haven't used any kind of contraceptives and they want to avoid getting conceived, then in that case, they can go for this oral contraceptive. That is your unwanted 72. These are called as, these are some of the like brands over there. These are called as my emergency contraceptive. They have to be taken 72 hours before the, like within the 72 hours after copulation. So that is why you call them as the emergency contraceptive. Okay. Taken within the 72 hours to avoid possible pregnancy due to rape or unprotected coitus. Now let's talk about my sterilization. This is a surgical method and it's a permanent method. So once a person undergoes a sterilization, then there are no, you cannot reverse it back. Okay, so यहाँ पे आपको क्या मिलता है देखने के लिए, that surgically either you cut the fallopian tube or you cut the vas deferens in the males. So surgical intervention block the gamete transport and thereby prevent conception. So assume that in the male, if you cut out the vas deferens, यहाँ पे आपने vas deferens को कट कर दिया और टाई कर दिया, तो यहाँ पे आपका हो गया वासेक्टोमी. अब वासेक्टोमी करने के बाद एक चीज आपको यहाँ पे याद रखनी है, वासेक्टोमी विल अवॉइड एनी चांसेस of the sperms reaching into the urethra. But you should also understand vasectomy does not mean कि sperm formation नहीं होगा. Sperm formation होगा. The sperm formation will happen over there, but the sperm will never reach to the urethra. Okay. So ejaculation will only have the seminal plasma, but not the sperm. So that is what you find happening in my vasectomy. Similarly, you will have the tubectomy. So in tubectomy, what will be happening? That you will also have the fallopian tube cut and tied. Now, when you do the cutting of the fallopian tube over here, so what will be happening in this? That once it has been done, please understand this thing very carefully, that there are no chances that ova can fertilize with the sperm. There is no chance of that. But you will find ovulation happening. हर महीने ovulation होगा, हर महीने endocrine lining बनेगी. The only thing you have to know here is कि menstrual cycle यहाँ पे affect नहीं हो रहा. सिर्फ यहाँ पे एक बात यहाँ पे कभी होगी नहीं, that your ova will never meet the sperm. So that is something you have to know. So that is one thing you have to know about the vasectomy and tubectomy. तो ये चीज आपके यहाँ पे आ जाती है. This is what you have to know about the vasectomy and tubectomy, and these are my permanent method. Once these are the methods people go for once they are very much sure that they don't want to have any more children in the family, then they can go for this kind of surgery. ठीक है? तो इनको हम बोलते हैं यहाँ पे as a sterilization, and they are the permanent method to getting conceived, avoiding getting conceived. Surgical methods are also called as sterilization and are generally advised for the male and the female partner as a terminal method to prevent any more pregnancies. Okay, so that is something we have done. So the other few things we have done. Now let's solve some questions. So here we have match the following. देखो ध्यान से and quickly answer in the chat. Which will match with what? बताइए. Right, someone has answered. Military School Ludhiana has given me a very quick answer, as usual. Anyone else? देख लो कर लो जल्दी से. All right, Talwara has also answered. Okay, now let's have a look in this. The pill के साथ आपका यहाँ पे आएगा, it is going to prevent the ovulation. Something you know that, right? So ये किताब में 3 आएगा. Your condoms are going to prevent the sperm reaching the cervix. That's also true. Vasectomy means the semen with contain no. I've told you that after vasectomy there will be a seminal plasma, but no sperm will be seen in that. And copper T is going to prevent the implantation, right? So basically it is going to suppress the sperm motility over there, and there's no chances of getting conceived in that condition, right? That is what you find happening in this. And this is why option C becomes the correct answer. Okay, this one. What is the work of copper T? Copper T आपका यहाँ पे क्या कर रहा है? What is going to be the work of the copper T? Why option C? इतना कॉम्प्लेक्स काम होता है कॉपर टी का? To inhibit implantation of blastocyst. ये आपका फर्टिलाइजेशन ही होने नहीं देगा. कॉपर टी के बारे में क्या पढ़ा था बेटा हम लोगों ने? That it is going to suppress the sperm motility. कॉपर टी आपके यहाँ पे क्या करता है? It is going to suppress the sperm motility. It is going to suppress sperm motility. ये हमने पढ़ा था ना यहाँ पे कि sperm motility को ये suppress करेगा. अब जो ये sperm motility को suppress कर रहा है, इससे क्या होगा? You will not even find fertilization taking place. The fertilization will also not happen over here. Please understand this thing. So it is going to inhibit the fertilization, right? वो तो सेकेंडरी चीज होती है कि वो अपना it is going to make the suitable implantation के लिए वो suitable नहीं रखता यूट्रस को, but the first thing it will also ensure that there is no possibility of fertilization. because it will reduce the sperm motility, and because of that, the sperm will get eaten by the vaginal tract. So yes, option B becomes my correct answer. This one. What is the work of progesterone which is present in the contraceptive pill? The progesterone you find in the contraceptive pill, what kind of role it will play? Again, आसान सवाल है, काफी आसान सवाल है. You can answer this. Right, Ludhiana has answered, Gurdaspur has answered, and these are all my correct answer. Yes, to inhibit the ovulation. So you don't find any kind of ovulation happening when you have this progesterone present, okay, in the contraceptive pill. Contraceptive pill का काम ही एक होता है बेटा याद रखना, to avoid the ovulation. So this is something should be clear to you. The most important component of the oral contraceptive is what? इनमें से कौन सा आपका सबसे important component होगा आपके oral contraceptive का? Right, true. Gurdaspur, Ludhiana, and Talwara, that's true. Progesterone. I hope you do understand. Once you have a progesterone, na, so it will actually alter the complete cycle over there in the females, and that is why you won't find any kind of ovulation happening. Okay. Tubectomy is a method of sterilization in which. So what happens in tubectomy? All right, Gurdaspur, Ludhiana has given me a correct answer. Yes, small part of fallopian tube is removed or tied up. Small part of fallopian tube or removed or tied up. That's going to be your option A. बिल्कुल सही. Of the following is not a method of contraception. इनमें से कौन सा एक method नहीं है contraception का? Tell us. क्या बता काफी जल्दी कर दिया. Right. Pills with a combination of my oxytocin and reciprocin. इनका कोई काम नहीं होता. इनका कोई काम नहीं होता contraception को लेके. So that is why option B becomes my correct answer in this. Pills of a combination of oxytocin and reciprocin. What is the figure given below showing in particular? ये जो पिक्चर आपके सामने यहाँ पे दिखे थोड़ी ब्लर दिख रही होगी आपको आपके बड़े स्क्रीन के ऊपर, बट स्टिल आप बता सकते हो यहाँ पे. Yes, it is my tubectomy. Right. Which of the following is the most widely accepted method of contraception in India at present? कौन इससे सबसे widely accepted method है आपके यहाँ पे contraception का? बिल्कुल सही. That's true. It is going to be the IUDs. Intrauterine device are most widely accepted methods. Tubectomy is a method of selection in which something we have done this. इसको हम कर चुके हैं यहाँ पे. Option आएगा यहाँ पे आंसर. Read the statement carefully and tell me identify the incorrect statement. ध्यान से देखो स्टेटमेंट को, बताओ कि इनमें से कौन सी गलत स्टेटमेंट है. स्टेटमेंट वाले क्वेश्चन में मैं चाहता हूं कि आपका ग्रिप बने अच्छे से, सो बी केयरफुल. All right, I have received 4 answers and all those 4 answers are my option C. तो आप लोग कह लो कि ये मेरा स्टेटमेंट यहाँ पे गलत है. वो जो मेरा यहाँ पे स्टेटमेंट कह रहा है, अल्ट्रासाउंड हैव बीन बैंड एज इट वाज यूज्ड फॉर अ फीटल सेक्स डिटरमिनेशन बेस्ड ऑन द क्रोमोसोम स्टडीज. ये बात आपके यहाँ पे बिल्कुल गलत है. राइट. सो बिकॉज अल्ट्रासाउंड को हमने बैंड नहीं किया, हमने फीटल फिटिसाइड को बैंड कर दिया. अल्ट्रासाउंड तो बेबी भी करा सकते हो, बट यू कैनॉट गेट टू नो द सेक्स ऑफ द बेबी बिकॉज ऑफ दैट. सो अल्ट्रासाउंड को बैंड नहीं किया है. वी हैव एक्चुअली बैंड द फीमेल फिटिसाइड जो डॉक्टर्स करते हैं उनको हमने वहां पे बैंड कर दिया. तो यस, ऑप्शन सी बिकम्स द करेक्ट आंसर. वेरी गुड. चलो, फाइंड द इनकरेक्ट स्टेटमेंट फॉर आईयूडी. लुक एंड फाइंड फॉर इनकरेक्ट स्टेटमेंट. बहुत जल्दी आंसर कर दिया बेटा आप लोगों ने. राइट. They can be self-inserted. ये बात आपके यहाँ पे गलत है. You cannot find IUDs being self-inserted. So you cannot find that happening. Now let's your medical termination of pregnancy. So when you talk about the MTBs, that is nothing but my medical termination of pregnancy. Now, MTP is the one which can be carried out within the 12 weeks. Within 12 weeks of the pregnancy. If someone goes beyond that, then that might become a matter of concern for that particular lady because it can be life threatening. So MTP सजेस्ट किया जाता है कि अगर वो MTP मेडिकल टर्मिनेट करना हो प्रेगनेंसी को तो इट हैड टू बी डन विद इन द 12 वीक्स. बेसिकली इसको सिंपल तरीके से हम इसे अबॉर्शन भी कह सकते हैं. विल बी डन बाय द डॉक्टर्स अंडर सुपरविजन. So the question is that why NTP is going to be allowed and when it is not allowed. So when a couple is trying to have a child with a specific sex, then they happen to try to get rid of the female fetus, and that is why it has been banned for those cases. So MTP आप सिर्फ करा सकते हो कुछ कंडीशन के अंदर, बाकी चीजों के लिए इसको हम अलाउ नहीं करते हैं. याद रखना एक लॉ पास किया गया था इन द 1971 जहां पे एमटीपी को लीगलाइज किया गया था. इन द ईयर ऑफ 1971 द एमटीपी वाज लीगलाइज्ड अंडर सर्टेन गाइडलाइंस. एमटीपी किया जा सकता है बट अंडर सर्टेन गाइडलाइंस और अंडर सर्टेन कंडीशन इट कैन बी डन. राइट. अब सवाल यहाँ पे ये आता है कि एमटीपी जिसको यहाँ पे हम टर्मिनेट करें प्रेगनेंसी, ये आप कौन से कंडीशन पे आप कर सकते हो. Assume that there's a chromosomal disorder. Assume that there's going to be a chromosomal disorder. Then MTP कराया जा सकता है. क्यों कराया जा सकता है? Once you know that a baby will be having a chromosomal disorder and will have a difficulty in surviving, then in that case MTP is allowed. That's one thing. Second thing, failure of the contraceptive. Failure of contraceptive. If the contraceptive hasn't worked within the couple, then they can go for the MTP. And if they want to avoid the pregnancy, they can go for the MTP. Right. Sexual assault. If a girl has undergone a sexual assault, then in that case also, if at all there's a chance of attaining the pregnancy, then the girl can undergo the MTP. Right. These are some of the okay, one more thing. Yeah. If the offspring or the fetus is a threat to the mother, in case if the fetus happens to be threat to mother. Sometimes pregnancy can be threatening to the mother. In that case, you can go for the MTP. कई बार होता है कि जो है प्रेगनेंसी होती है, if sometimes it might happen at such an early stage, or it might happen in those conditions when the girl itself is suffering with some kind of disease. So what time pe the MTP can be avoided. MTP can be done and you can avoid the pregnancy. So fetus, if happen to be a threat to the mother, then you can go for this termination. Sexual assault is something I've told you. If the contraceptive are going to fail, then the MTP can be used. And if there are some kind of chromosomal disorder, if पहले ही पता चल जाता है कि chromosomal disorder है, then it is very much allowed. It is legal to terminate the pregnancy within the supervision of a doctor. तो इतनी बातें आपको यहाँ पे रखनी है. These are the few things first of all you have to know. Now, after this, so there is something we have done now. Intentional or voluntary termination of pregnancy before the full time, we call it the induced abortion. 40 to 45 million, 45 to 50 million MTPs are performed every year all over the world. Again, a number which you have to know. 1/5 of the total number of conceived pregnancy in a year. So how many pregnancy which has been happening throughout the world now? 1/5 of that do undergo induced abortion. MTP has a significant role in decreasing the population, though it is not meant for that purpose. Something I've told you, MTP की वजह से आपका एक बहुत ही सिग्निफिकेंट पॉपुलेशन में आपका यहाँ पे नंबर नीचे आया, बट इसका पर्पस ये नहीं था. इसका पर्पस बेसिकली आपको ये था दैट इफ यू वांट टू अवॉइड सम काइंड ऑफ अनवांटेड प्रेगनेंसी, तो आप उसको लाइक अवॉइड कर सको. ओके. और यू वांट टू अवॉइड अ प्रेगनेंसी व्हिच काइंड ऑफ हैविंग विद द बेबी some kind of defect which will make his or her life difficult throughout the period. So that is why in that case you can go for the MTPs. So Government of India legalized the MTP in the year of 1971. And it actually restricted the female feticide. The idea was to make sure that no female child must be like the idea was to make sure that people are not actually getting rid of the female fetus, which used to happen previously, but now it is not been happening because people are aware and conditions have changed a lot. Okay, now let's have a look at this term. MTP यहाँ पे आपका किस लिए stand करता है? It's a very simple question. You all know this. It is going to be the medical termination of the pregnancy. Okay. Need for MTP. So where the MTP is to be needed to prevent the unwanted pregnancy. That's one thing. Something I've told you. Okay. Continuation of a pregnancy could be harmful to both mother and the baby. So sometimes getting conceived might have an ill effect on the mother's body. So that can be done. यहाँ पे unwanted pregnancy, like because of a absence, failure of the contraceptive, one can go for the MTPs. So it is going to be safe till the first trimester. तो 12 वीक्स के विद इन में ये सेफ रहता है. अब अगर कोई 12 वीक्स के बाद अगर एमटीपी करा रहा है तो डॉक्टर काफी क्लियरली बता देगा वहां पे दैट इफ समवन गोज फॉर एमटीपी आफ्टर 12 वीक्स देयर इज अ स्लाइट चांस दैट इट माइट बी अ लाइफ थ्रेटनिंग टू द मदर एज वेल. एक सर्टेन टाइम के बाद वो थोड़ा सा लाइफ थ्रेटनिंग हो सकता है मदर के लिए भी. तो वो टाइम पे डॉक्टर काफी क्लियरली कुछ चीज आपके साथ शेयर कर देंगे. ओके, सो बेसिक बेस्ट प्लान आपके यहाँ पे रहता है दैट यू मेक द एमटीपी हैपन विद इन द फर्स्ट 12 वीक्स. It has always been performed by a qualified medical personnel. याद रखना MTP cannot be carried out by a nurse. It has to be done with the doctors. And to restrict the female sex determination. Previously, it was done that people used to use the ultrasound and they used to get to know the fetus of the sex of the baby. But now it has been avoided. Now, you have 4 statements in front of you. Tell me which is the correct answer. बताइए क्या होगा इसके अंदर आंसर आपका. ओके, सब लोग यहाँ पे ऑप्शन डी कह रहे हो. So option D आपके यहाँ पे सही आंसर है. बिल्कुल सही. MTPs are generally advised during the first trimester. That's one thing. MTPs require the assistance of a qualified medical personnel. So you have a A, you have a C. So these are some of the notes you will find in terms of the termination of pregnancy. So this is what you have to know. There's something I've told you previously. There's something called as my ectopic pregnancy. याद रखना. मैं आपको पहले बता चुका हूँ. अब ectopic pregnancy में आपके यहाँ पे क्या होता है that the implantation happens anywhere except the uterus. Like for example, if there is an implantation happening in the fallopian tube. Implantation in fallopian tube. Now, if there is going to be implantation in the fallopian tube, then there is a likelihood, there is a very likelihood that you will have a spontaneous abortion in that case. Generally, fetus वहाँ पे ग्रो नहीं कर पाता and वो टाइम पे you will find it will detach from the fallopian tube and will get out of the body. So spontaneous abortion भी यहाँ पे हो सकता है. और ectopic pregnancy generally risky होती है. Ectopic pregnancy अगर आपका implantation uterus के कहीं और हो रहा हो, you call it ectopic pregnancy and generally it's going to be risky to the mother's health. So these are the years which you have to know, 1971 and other things, right? So that is something we have done. Now let's talk about my sexually transmitted disease. ये ज्यादा तो हम यहाँ पे कर नहीं पाएंगे, but let's understand few things over here. जब मैं STD की यहाँ पे बात करता हूँ, then you can have number of symptoms of the STDs. अब जनरली STDs आपकी बहुत सारी होती हैं, जो हम कल देखेंगे कि कौन सी आपकी STD होती है. कल आपका चैप्टर भी होपफुली खत्म हो जाएगा. So STDs आपकी बहुत टाइप्स की आपको मिल जाती है. But STDs के अंदर याद रखना है that what are the symptoms in them, and majority of the STDs will have a common symptom. What can the common symptoms over there? Like burning sensation, pain in genitalia. That's one of the very common symptoms of the STD. Second thing, pus secretion from the genitalia. Pus secretion genitalia. Then you can have, so you have the body burning sensation you will find happening in the genitalia. You can have the pus secretion will be happening in the genitalia. You can find that happening. At times, you can find some vital organs will have inflammation, like ovaries or urethra inflammation. So inflammations of the vital reproductive organs. And over here that ये सब जो हम यहाँ पे लिख रहे हैं ये सब होता किसकी वजह से सो योर STDs can happen because of number of reasons. Either they can be a bacteria, either they can be a virus, or they can be something like a protozoan. Even we have some fungi as well, which have the potential to form the STD, but फिलहाल क्या इतना ना यार को. You can have viruses, bacteria, protozoans. They are known to cause the STDs, and if at all it happens, so यार कितना STDs होने के बाद, it depends which kind of STDs it is going to be. Some of them are completely curable, and some of them are not curable. One of the example of my not curable STD is going to be the HIV. You know this thing very clearly that HIV is one of the STD which is not curable, right? Then you have a genital herpes. These are the two examples of your STDs. These are the two examples of STDs which are going to be transmitted from, like these are the STDs which are not curable. Mention at the top यहाँ पे, they are not curable. अभी अगली क्लास में जब हम लोग मिलेंगे ना, when we'll catch up in the next class. So in the next class we'll do all these STDs. STD को हम यहाँ पे देख लेंगे and then we'll do the last part. That's going to be your reproductive assisted technologies, right? So assisted techniques वो हम वहाँ पे देख लेंगे. So we'll try to see that as well. So कल आपका चैप्टर खत्म हो जाएगा. बेसिकली हम कल चैप्टर खत्म करके शायद हम कुछ क्वेश्चन यहाँ पे सॉल्व कर पाए. So that is the idea. We'll try to complete the chapter tomorrow itself and we'll solve some questions over there. Okay. STD खत्म करेंगे and then we move on to your this assisted techniques, right? So yeah, these are the things we have done आज की क्लास में. We have solved some question. Try करेंगे कल थोड़े ज्यादा क्वेश्चन सॉल्व करने का. कल चैप्टर भी आपका खत्म हो जाएगा. So that's what we'll try to do, right? Okay. So यहाँ पे मैं लेक्चर अपना खत्म कर रहा हूँ because you also have one more class after this. Okay. So if you have any question, you can ask a question. All right. चलो. We'll catch you in the next class. Bye.